My name is Dr. Sandy Christiansen. I'm a board-certified obstetrician-gynecologist licensed in the state of Maryland and the National Medical Director for CareNet. In addition, I am the state representative for the Maryland members of the Christian Medical and Dental Association, and I am a medical director for a local pregnancy center. I want to get the word out today to our Maryland voters about an unprecedented challenge to the Constitution of our state. This fall, you will have an opportunity to vote for or against the Reproductive Freedom Amendment. If voted through, this would permanently alter the Maryland Constitution, making abortion a constitutional right with disastrous results and far-reaching effects. This amendment would put pregnancy centers in jeopardy, and it will be the women and men who fall through the cracks of our healthcare system who will suffer as a consequence. Let me tell you a bit about pregnancy centers. CareNet is a nonprofit pregnancy center affiliation organization dedicated to offering compassion, hope, and help to women and men considering abortion by presenting them with realistic alternatives and Christ-centered support through our life-affirming network of 1,200 pregnancy centers, our national hotline, and our church network. CareNet's most recent report reveals that our affiliated pregnancy centers across the nation provided the equivalent of $47 million worth of health services, nearly $9 million of material support, and $16 million of educational classes for parents, all free of charge. The state of Maryland currently has a strong network of pregnancy centers serving the people in their communities, and it is often the women who are without means who are especially in need of our services. Pregnant women who choose to abort their pregnancies find a well-funded wealth of resources in Maryland. Maryland is one of only 4 states that compelled taxpayers to fund abortion. Did you know that we pay millions in state Medicaid to reimburse abortion providers and millions more to subsidize the abortion industry and train their workforce? What about the poor women who choose motherhood? They need support for their families, and they rely upon the valuable resources pregnancy centers provide. No woman should feel she can't have her baby simply because of her financial situation. Pregnancy center work has been under attack for years from those who would like to see our doors closed. The abortion industry is very strong in Maryland, but the pressure to close will only intensify if this constitutional amendment is voted in by the public. A few years ago, I testified in Annapolis in opposition to a bill that would have required me as a physician to tell my patients that I wasn't going to give them factual information. Montgomery County and Baltimore City tried to force pregnancy centers to post signs about abortion or face fines of up to $150 a day. Fortunately, these false claims and unconstitutional bills were met with defeat. However, if abortion becomes a constitutional right, any perceived interference may be the catalyst for a lawsuit. While these lawsuits may fail in the end, it is the process that threatens the pregnancy centers. While these lawsuits may fail in the end, it is the process that threatens pregnancy centers. There are organizations that will provide free legal representation, but there aren't enough for every case. Any legal defense is expensive. The abortion industry receives hundreds of millions of dollars of funding through our tax dollars. Pregnancy centers survive primarily from the generosity of their private donors. Instead of those heartfelt donations going to help the men and women and their children, the money would be needed for legal defense. This could certainly lead to the closure of pregnancy centers for lack of funds. I meet women in our pregnancy center clinic every week who have been duped by the abortion industry and harmed by their abortion. If this constitutional amendment is voted through, abortion would be a state constitutional right, and no law could be enacted that appeared to interfere with this right without proving a compelling state interest in costly court battles. This bill would effectively nullify existing protections and prevent future pro-life legislative challenges, rendering the abortion issue effectively bulletproof. Without any checks and balances to abortion, the health of women and girls would be at risk. Maryland taxpayers would be forced to fund late-term abortions for women coming from other states at a cost of millions per year. Pro-life services could be banned, leaving marginalized women with fewer resources. Pro-life healthcare professionals could be forced to participate in abortion procedures or risk loss of licensure. Our healthcare system is broken, and many people who are uninsured rely upon Maryland pregnancy centers to help them make it through a tough time. In closing, even if you believe women should have access to abortion, Maryland already has abortion laws in place that more than protect a woman's right to choose abortion. Codifying abortion in Maryland's Constitution actually takes away women's rights because it will stifle laws designed to implement common sense abortion safeguards. Further, if pregnancy centers are jeopardized, women and families managing an unexpected pregnancy would have fewer resources and suffer as a consequence. I urge you to spread the word about this harmful amendment and make your voice heard at the polls.